So in this video, we're going to get a little bit deeper into the anatomy changes following the surgery. And what we mostly mean by that, it's a few fold. So one, penile length expectations, it's going to change. Whenever they take the prostate out, they have to re-stitch together your urethra through what's called an anastomosis. And whenever this happens, that stitching basically puts a force internally that works on retraction of the penis. So losing some length is normal. We don't want it to come as a surprise. It's probably already been talked to you about. You've probably seen it online or with your physician. But we just like to cover it and talk about how this is a part of the recovery process, is working the muscles, but also creating, just like with any other kind of scar tissue following a surgery, a scenario where things are laying down. So we're going to teach you how to gently traction and massage the base of the penis. So as those things are healing, you're not losing too much length or more length than you should just because you just let it be. The second thing is retrograde ejaculation. So it is very normal to still have orgasms and climax following surgery, but the expectation there should be that it's going to be a dry ejaculate. So nothing's necessarily going to come out, but you're still going to have the sensation. It's also very normal that patients report that there is decreased sensation for a time following the procedure. And then the third is kind of wrapping back into the last video where we talked about the Cialis and Viagra, and that is erections and when you're having erections. So we say nocturnal erections, where when you're asleep, your body goes through a process of promoting blood flow to the penis. This is why sometimes in the middle of the night or in the morning you wake up with morning wood. It's the body's natural process of promoting blood flow to the penile structures, so they're getting maintenance, kind of like an oil change. And this needs to happen pretty frequently on a nightly basis so those penile structures do not atrophy. Following surgery, that sequence, that cycle of having those nocturnal erections, or what we call maintenance boners, tends to be knocked out. So this is also an important factor as to why we suggest talking to your doctor about the Viagra or the Cialis, as well as this is why we promote using the penis pump early on, because the penis pump is going to help you shunt blood to the penile structures, as well as exercise, as well as masturbation. So in the next video, we're going to talk about what sexual function is going to look like following surgery and tips and tricks on how to stay satisfied both with yourself and with your partner.